KTVU's Evan Cernovsky joins us now with more on this story. Evan.
That's right, Julie. KTVU first reported this issue after hearing from whistleblowers last week. Now, the state just concluded its investigation, and it found that even more people were affected than we previously knew about.
I went through all this trouble, and then they didn't even get it right. And I thought, how can that happen?
The California Department of Health now says that 6,300 people got less than the optimal dose of the Pfizer vaccine last week at the Oakland Coliseum. KTVU obtained a letter the department sent to some patients. It says the error took place between Sunday, February 28th after 4:30 p.m. through 3 p.m. the next day. It happened when workers began using syringes that left some of the vaccine behind. Patients were supposed to get 0.3 milliliter shots, but state officials said some people only received 0.22 milliliters.
Didn't anybody just check and test them out and make sure they worked okay, especially if it was a different syringe?
Jim Schaefer was one of those patients. He learned about the mistake from KTVU and still hasn't been contacted by the state.
It would have been nice to get some kind of confirmation from them that you're not at risk because of this situation.
After KTVU first reported on the whistleblower complaints, the State Office of Emergency Services, which runs the Coliseum site, released a statement denying any knowledge of anyone being formally underdosed. After visiting the site, the state health department has now acknowledged the issue, but said the lower doses are still sufficient.
The question that I'm getting, and I'm sure lots of people are getting, is what do I do now? And the answer is nothing.
Dr. John Swartzberg is a professor at UC Berkeley specializing in infectious diseases.
The good news is that the amount you got between the two doses is more than sufficient to give you the immune response that you need.
Now, both the CDC and Pfizer say that even half of the 0.3 milliliter dose is sufficient, and anyone that may have gotten the lower dose doesn't need to get a replacement. Reporting live, Evan Cernovsky, KTVU, Fox 2 News.
And Evan, just one quick question. I don't know if you're able to answer this, but if it happened at the Oakland Coliseum, is there any concern that these syringes may have been used elsewhere and the same problem happened at other places giving the vaccine?
Sure, there's obviously concern about that. We haven't heard about any other cases where that happened, but fortunately this was caught relatively soon, so other vaccination sites have this information now and hopefully won't make that same mistake. Julie?
Yeah, know what to watch for. All right, Evan, thank you.